Join us now for Health for Life, brought to you by Vitruvian Health, formerly Hamilton Healthcare System. Today we're talking with Dr. Nancy Carnevale of Anna Shaw Children's Institute in Dalton. Thank you for joining us, Dr. Carnevale.
Thank you for having me.
Dr. Carnevale is a board-certified child development pediatrician and the medical director of Anna Shaw Children's Institute, located at 1201 Burleson Road behind Hamilton Medical Center in Dalton, Georgia. She specializes in attention disorders, autism spectrum disorders, behavioral and developmental challenges, and more. Dr. Carnevale graduated from Assumption College in Worcester, Massachusetts, attended medical school at Brown University in Rhode Island, and completed her residency in pediatrics at the University of Connecticut. She also completed her fellowship at Brown University and is board certified in neurodevelopmental disabilities. So, what is separation anxiety?
So separation anxiety is actually a normal part of a child's development, and it's characterized by kind of fear or distress when they're separated from their parents or other primary caregivers. It's most common in children usually between the ages of 8 months and 4 years of age. However, it can be really challenging when a child starts school or faces new situation when they're away or separate from their parents.
So it could start in infancy, right? Is this related to object permanence?
So yes. So separation anxiety develops after a child gains an understanding of what we call object permanence. So before an infant develops object permanence, they believe that when an object disappears from their view, it just really no longer exists. However, as they get older, they begin to understand that an object continues to exist even when it's out of sight. So you'll see them kind of, you drop something and they'll search for an object and they'll even remember when they saw it last. So again, there's a covered up object or a dropped object and they start to understand that that object still exists. It's kind of like when we play peekaboo. I'm there, I'm not there, I'm there, I'm not there. And once your infant realizes that when you're really gone, from them, but they know you are still around, it may make them feel kind of unsettled. So object permanence is this understanding that objects continue to exist even when they're not in our direct line of sight or when we're not interacting them. So they may become upset when their parents now leave to go into another room.
Once they develop this, what happens?
So separation anxiety can happen. That's when, again, they know their parents are there but not with them, and they start to get nervous. It varies widely. Some babies will become hysterical when their mom is out of sight for a short time, but then eventually adapt nicely. And this is when we advise parents to do kind of a lot of coming and going, leave the room for a minute, come back, leave, come back. And then the child learns to play independently and that their parent will return. However, other children seem to demonstrate this ongoing anxiety at separations when they're infants and when they're toddlers and right into preschool. Separations are often more difficult also when a child gets hungry or tired or sick. And as children develop independence during toddlerhood, they may become more aware of the separations. So their behaviors at separations might be easy. They just kind of leave and go where they need to go. Or they might be loud, tearful, and sometimes difficult to stop.
It seems like separation anxiety can be difficult for some children. What are some of the ways that parents can prevent this from becoming a problem?
There are several strategies parents can implement to help their child manage separation anxiety. One of the most important things parents can do is establish a consistent routine with their child so the child knows what to expect and feels secure in their environment. So establish a predictable routine, especially during drop-offs and at bedtime when you're going to be separating from your child. And this creates a sense of security. Also, practice gradual separation, which means slowly increasing the time the child spends away from their parents. So again, at home, that can consist of a lot of coming and going in the house, leave the room, come back, leave the room, come back. Then maybe try to leave the child with another caregiver. So even if it's just for an hour on a weekend where they are comfortable, maybe with their grandparents or family. And this, again, helps them build that confidence in their ability to cope with separation. And again, reassure and comfort your child with positive affirmations during these times, but avoid prolonging the goodbye. You don't want to be saying goodbye forever. And then this will help prepare your child before starting daycare or preschool. So you want to give your child a chance to experience your absence.
Wow. So does this impact a child's sleep once they have separation anxiety?
So separation anxiety can also significantly impact a child's sleep. So children with separation anxiety often have a hard time falling asleep or staying asleep when their parents are not right right with them. So the parent then will stay with their child until they fall asleep. The problem with that is when they wake up, when the child wakes up, as is normal for all of us, we all wake up in the middle of the night, they are anxious and they cry for their parents, and then the parent returns to the child. And this can go on several times a night, and this causes disruptions in sleep, both for the child and for the parent.
How would this separation anxiety manifest itself at school?
So in a school setting, children with separation anxiety exhibit clinginess. They're kind of holding onto their mom's leg. They're crying. Some of them will just have terrible tantrums when they're dropped off at school. And then if they're thinking about this all day or they can't recover, they may have difficulties concentrating or participating in regular classroom activities due to their preoccupation with this anxiety. This, of course, then affects their academic performance and their social interactions with their peers.
Many children might already be going through this. How could parents help them?
If a child is already experiencing separation anxiety, there are a few things parents can do to help. One is that parents really need to stay calm and reassuring when they say goodbye to their child, because the child will pick up on their emotions. Children always read parents' emotions. Secondly, the parents can provide some type of transitional objects. That may be a special toy or a blanket that the child can hold when they're apart. Another thing parents want to do is create a quick goodbye ritual. So keep it short and sweet. If you linger, that transition time does too. So will the anxiety. So when separating from your child, give your child full attention, be loving, provide affection, and then say goodbye quickly despite their cries for you to stay. And again, ideally, parents start off with these short and gradual increases in the amount of time their child spends away from them. And that's starting with those short periods and gradually increasing as their child becomes more comfortable. Another thing that they can do is to make sure that they're specific about how they communicate with their child. So when you talk about like coming back, provide some specifics for your child. So if you know you're coming back at 3, tell them, something in that the child can understand, like I'll be back right after nap time, or I'll be back right after afternoon snack.
When should parents be concerned about their child's separation anxiety?
So again, even that separation is a normal part of development, it can become a cause for concern if it's excessive or if it persists beyond the age that we expect it. So if a child's separation anxiety is interfering with their daily functioning, causing significant distress, those are times to be concerned. So it's rare that separation anxiety persists on a daily basis anyhow after those preschool years. And if it does, or if it's really causing impairment in the whole family's functioning, it's probably time to seek some professional help. And that's where a pediatrician or a mental health professional can help evaluate the situation and provide some guidance on the best course of action.
Yeah, this is kind of off topic. Well, no, it's pretty much on topic. I can relate to separation anxiety, especially in children, because when I was a child, I very much had that. And, kindergarten to first grade, I would just cry almost every day to the point where my teachers got tired of it. But eventually, I got over it. But yeah, I just couldn't get over being away from my parents.
So again, it's a common thing, and you can see how hard it is for the parent, because the parent doesn't want their child to suffer and experience that anxiety, so sometimes they have a hard time letting go. But again, the idea is hopefully to do it somewhat gradually and also see that the child is eventually successful. What I hear from teachers all the time or from parents is the parents will tell me, he cried, but the teacher called me 5 minutes later or sent us pictures, and he was fine playing with other children. And I think once parents know that, they feel more comfortable and they're willing to make that goodbye and that cut, and the child adapts.
For more information about Anna Shaw Children's Institute, call 706-226-8900 or visit hamiltonhealth.com/children. For an appointment at the Institute, please ask your child's pediatrician for a referral.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.